everyone, it's Casey and Rufus, and today we have a great video on the importance of your cat's annual exam.
Charlene, I'm Dr. Metzger. How are you doing today?
I'm good. How are you?
Very good. Obviously, this is Boomer.
Yes.
How's he doing today?
Boomer's doing well.
I know he's just in for an annual wellness exam today. There's really nothing wrong. Is that correct?
Correct.
One thing I always like to ask, so on a scale from 1 to 10, if 10 is normal for him, just his normal activity, normal appetite, where do you think he's at today?
I'd say probably 8.5, 9.
Okay. So he's not perfect, but being in here probably doesn't make it a whole lot better.
Exactly.
And I know you have several other cats, which makes it kind of hard to tell who's eating and drinking and all that, right?
Exactly.
Let's do this. Let's do a physical exam, and I'll talk you through what we're going to do.
Okay.
And then we'll decide whether we want to do any blood work. It's kind of time to do blood work on him. I know he's only a few years old, but it's a good idea to get some baseline data, so we may want to do that today.
Okay, that sounds
but let's
good.
look him over and see what we think.
That sounds good.
Okay?
Thank you.
All right, Charlene, so I'm going to do a physical exam on Boomer now.
Okay.
And I want to show you exactly what I'm doing.
Okay.
So first thing I like to do is, first of all, he's a very nice kitty. You brought
you.
your nice one today, didn't you?
I did. The other one I left at home.
A couple things I like right away. I mean, he's very attentive. His eyes are nice and clear. He's doing what a normal kitty would do. In fact, he's doing more and better than a normal kitty would do.
Good.
First thing I like to start with, especially in the cats, is listening to the heart, because it gets a little scary in here sometimes. So first thing I want to do, he's very good. I like to listen to the left side, and there's actually a couple things we're listening for. One is the heart rate, but I want to make sure he doesn't have any murmurs.
Okay.
And we start on the left, and we're actually listening to 3. There's 3 heart valves on the left and 1 on the right. So I'm listening to the ones on the left right now. And that's the mitral, the aortic, and the pulmonary. Great. No murmurs, normal rates. And then on the right side, we're going to listen to the tricuspid valve, which is right here. Does all sound great?
Good.
Excellent.
Good job.
Then what I like to do is we really want to look at the teeth and as much of the mouth as we can. And this is kind of cat dependent. Like, he's very good. So he has very minimal tartar because obviously he's not a very old kitty.
Mm-hmm.
I'm just looking at how much tartar we have. I'm just looking for any dental caries, like basically cavities. Make sure we don't have any broken teeth. He's being very good. If I can, and he's pretty good, I actually want to look in that mouth. I want to look under the tongue if I can, which he's letting me, which some cats won't. So that's really good. I always like it when I can look in the mouth. Then I want to feel lymph nodes. There's lymph nodes right under the jaw right here on each side. I want to make sure they're not enlarged, basically. And then in front of the shoulders, those are called the prescapular lymph nodes. Those feel good. And then right behind the knees, there's 2 on each side. There's 1 on each side called the popliteal. So I'm feeling the right and the left. And you want those to be normal and not enlarged. And they're normal. That's great. I just want to feel general body condition too. And what's his coat like? I mean, he's got a nice coat. It's not dry. He's not matted. I don't see any flea dirt, which is great. And then just the musculoskeletal structure. He's got good muscle tone. Some kitties, you can tell, are just laying on the couch all day like mine. So nice. I'm just feeling for any swellings or any pain. You know, I want to feel the joints. Make sure he's not painful anywhere, and he doesn't appear to be painful. He just wants to get out of here. And I want to look under the tail. Make sure we don't see any swellings or anything. That's good. And then I want to palpate his abdomen. Palpation just means I'm going to feel it.
Okay.
So I want to start. I like to start here in the front part, and this is where it's hard for you to see what I'm doing. That's why I like to tell you what I'm doing. But I'm going to start with the kidneys. So I'm going to feel the left kidney first, which is over obviously on the left side here. And then I'm feeling the right side. And I'm feeling for any pain. Are the kidneys enlarged or are they small? Like, he has normal kidneys for a kitty, which is great. I'm feeling for the liver, mainly for liver enlargement. Normally you can't feel a whole lot of the liver unless it's enlarged. And then I'm feeling for things like the urinary bladder. Just make sure he's not painful. And then I'm feeling the abdominal loop area, basically the intestinal tract. Make sure I'm not feeling any masses. You know, you don't have any masses in there. I want to make sure he's not painful, which he's not. And then I want to kind of end with looking in the ears, especially in the cat, because cats can get ear mites and stuff like that. So we'll look in there, and they get dirty ears. Obviously, they're not cleaning their ears. It looks like you are, because these are great looking ears.
Try to clean them about twice every 2 weeks.
That's great. I can tell you are, because they look great.
He's pretty cooperative.
I'll tell you, he's a great kitty. And then I just want to end by looking at the eyes. Make sure we don't have any cataracts, no pun intended. And make sure we don't have any cloudiness to the eyes. Or discharge. I want to make sure we don't have any ulcers or anything like that. He looks great. All right. Now I think his health looks great. He's got just a little bit of tartar, so we'll keep an eye on that. I want you to keep cleaning the ears.
Okay.
And then just keep bringing him in for his annual exams. I think you're in good shape. Do you have any questions?
I don't think so. Everything felt good in the abdomen. No problems.
Keep up the good work.
Thanks.
Thanks for bringing
Thanks,
him in.
Dr. Metzger.